Thank you very much, ladies and gentlemen. Good afternoon. As he has mentioned, my name is Mary O'Connor, and I'm here to represent the HR department within Cork Kerry Community Healthcare. I'm accompanied by colleagues today, Violet Ross and Noreen Cremin. We're delighted to be here. It's a fabulous opportunity for us to be able to talk to you about the vacancies and the employment opportunities we have in Cork Kerry Community Healthcare. So I'm going to tell you a little bit about Cork Kerry Community Healthcare. Violet will tell you a little bit about the employment opportunities that we have, and then Noreen will go into the specifics of how to become a healthcare support assistant and what the job entails. So, as mentioned, Cork Kerry Community Healthcare is a community health organisation. It's one of 9 within the HCSA, and it provides a range of services across the Cork and Kerry region to a population of approximately nearly 700,000 people. When we're service planning within Cork Kerry Community Healthcare, we have to take into consideration the large geographical area which incorporates areas of high population density and sparsely populated rural areas, including 7 inhabited islands. So we've included here a map of the geographical area of Cork Kerry, and we have included the 14 community healthcare networks which are currently dispersed within the Cork Kerry region, and Violet will tell us a little bit more about those in a moment. Within Cork Kerry Community Healthcare, our mission is to provide quality services to everyone within Cork Kerry to optimise their health and well-being. Our strategic priorities, we have 6, and they focus on access, to provide the best possible access to our services to service users. Our people, we value and respect our staff, our service users, their families and carers. We endeavour to deliver the best possible quality, compliant service. In respect of resources, we strive to create a culture of efficiency that makes the best possible use of resources in all our services. Health and well-being, we're very much focused on improving the health of everyone who lives in Cork and Kerry, and all to do with engagement. We want to foster a culture of pride, confidence and trust in the service that we provide. Our Cork Kerry Community Healthcare values are integrity, learning, partnership and respect. And we again strive to ensure that these characteristics are exhibited in everything that we do within Cork Kerry Community Healthcare. So to move to the national HCSA corporate plan, this details the HCSA's transformation agenda for the health and social care services and the progression of a number of Slán to Care objectives. Those include key actions to improve the health service and the health and well-being of the people living in Ireland, where we hope to deliver the right care at the right time to the right people. So that is our aim, to deliver the right care at the right time in the right place. So I'm now going to hand over to my colleague Violet, who will tell you more about Cork Kerry Community Healthcare.
Good afternoon, everybody. I'm initially going to speak about a number of initiatives we have currently in relation to and very much focused on Slán to Care. So we have about 6 major ones which we are pursuing at the minute. Winter planning is in relation to an integration initiative with the South-South West Hospital Group to enhance community care services in order to reduce the need for emergency department attendances and ultimately to avoid hospital avoidance. Our next area, most significant area, and Mary would have alluded to it in the map earlier on, is the enhanced primary and community care services. We have 14 community health networks where we hope to expand our services, again providing care to individuals in the right place and the right time. Our first initiative within the enhanced community care is looking at chronic disease, and that again is an initiative which is an integration initiative. There will be 4 assessment hubs and they're across Cork and Kerry. We initially will be looking at the areas of heart failure, diabetes and respiratory illnesses. We then have a further integration programme on older person services, and it's an ongoing rollout of community specialist teams who will focus on non-residential areas, providing care and treatment to older persons in order to avoid, again, hospital attendances and embracing the care within home first. Further initiative is the reform of our home care support and residential care services. So we're continuing to look at new developments within our residential centres, and we will have an expansion of one of our centres in the north side of the city in Heather House coming in the next few months. So our idea will be focusing on care within the community, providing it for those in a home-like atmosphere and a social model of care in order to avoid hospital admission and keep individuals at home as long as they wish to. My colleague Noreen will actually speak about the home support services shortly, but I just mentioned it here because we're in a process of reforming our home support service as well. Followed on from that, I suppose I'm looking at all care groups, including our mental health services and disability services. We're focusing on areas where we can improve that. We're looking at community-based services for our, I'll take for example our disability services. We've looked at a person-centred model rather than an institutionalised model, and we've moved a lot of our individual residents to community-based houses at the moment, and that has been working really well. It's giving them back their own home and having a sense of being within the community. To support all these services, we have recruitment initiatives currently running, and these are organised through our dedicated workforce resource unit, and that sits within the office of the head of HR within Cork Kerry Community Healthcare. So we have current vacancies across the following categories: medical and dental, nursing, health and social care professionals, and with that, in that I include our physiotherapists, occupational therapists, psychologists, dietetics. So there's a broad range of vacancies occurring at the minute. We also have vacancies with our other patient and client care areas, and that would be our healthcare assistants, HCSAs, working in the community. We also have vacancies within our support staff, which is our catering, housekeeping, etc. And we also have major vacancies within our management med services. So we welcome all applications, and we're delighted that we've seen such an interest today here within this particular expo. I'll just run through some of the employment opportunities. Within medical and dental, we have consultants, non-consultant hospital doctors, medical officers, general practitioners. Within nursing, we have opportunities for staff nurses, clinical nurse managers, clinical nurse specialists, advanced nurse practitioners, directors of nursing. Within our health and social care professionals, all therapy grades, occupational therapists, physiotherapists, speech and language therapists, podiatry, psychology, ophthalmology and dietetics. Within our other patient and client care, our health support assistant, healthcare assistants, support staff would include multitask attendants, catering assistants, housekeeping and also chefs. And management admin, we would have clerical officers and administrative officers. The benefits of working with us: we have good flexible working time arrangements. We have generous leave entitlements. There is an access to a pension scheme, and there are a significant number of promotional opportunities and career development opportunities. On that, I'm going to end my presentation and hand over to my colleague Noreen, who's going to speak on healthcare support assistance. Thank you for your time and listening.
Good afternoon, everybody. I'm delighted to be here today on behalf of Cork Kerry Community Healthcare to explain the role of the healthcare support assistant TOYO. So I suppose first of all I'd like to give you a historical context as to how this role developed in the first instance. So firstly it developed in the early 1970s and through the 1980s, where it was essentially a very informal type of a service with practical support and social support for people in their own homes. And it emerged from the high level of knowledge that the public health nurse in her local area had of people within that area who would benefit from this type of support, but equally from the knowledge that the public health nurse had of neighbours in the local community who would be in a position to support the older people living there in order to be maintained safely at home. So this developed through the input of public health nursing, and it has evolved over the decades to the current day, where it is now a fundamental aspect of community services in our country. So it is recognised as a hugely important service. It is delivered in a wide range of circumstances, providing personal care and essential household support to 7,400 clients in Cork and Kerry, 365 days per year. It's a highly valued role, and I think more than ever since we've had the experience of COVID-19, because the value of being able to live at home in one's own home for as long as possible is now recognised more than ever. The home support service, it aims to support service users, but as well as the service user, also their family, to enable the older person to live at home for as long as possible. And my colleague Violet mentioned the Home First approach as part of the integrated care programme, and the home support service is very much part of that approach to the delivery of service. Now, the home support service will be regulated into the future, and it will form part of a home support scheme. Now, what essentially does this role involve? Now, the healthcare support assistant in the first instance works as part of a team with the local home support resource manager, who is the line manager for the staff in a local area, but also with input from public health nursing, the physiotherapist, occupational therapist and speech therapist. And these professionals work collaboratively to provide the best possible service to the individual clients, and this is based on an individual need. The client's own specific needs are very much central to the delivery of this service. Now, the people who avail of this service are typically older people in the main, but we have other cohorts who also avail of this support. So, for example, younger people who may have disabilities. There is a family support element to the service, but also then we have clients in receipt of mental health service and palliative care also availing of the service. And all of these clients are referred for service provision following an initial assessment by the local public health nurse. So the public health nurse who essentially conceived the idea and the service, they're still very much to the fore of the governance of this service. Now, on a day-to-day level, the healthcare support assistant provides personal care which is very much specific to the individual client's needs. So they will assist the client with activities of daily living, and will also provide some essential household support where that is required, and this is governed by an individualised care plan which the public health nurse will have developed. Now, in order to be eligible to apply to become a healthcare support assistant, we have eligibility criteria. So in the first instance, QQI level 5, which is the major award, is required in a number of different areas. So healthcare support, in health service skills, nursing studies or community care. So if you have a QQI level 5 in one of these areas, then you are eligible to apply. Now we also have other eligibility steps. The next one I'll speak about is if you have completed 2 modules of a full QQI level 5, and the specified modules are care of the older person and care support. So if you have those completed successfully as part of a QQI level 5 overall, and you commit to completing the remaining 6 modules within a 12-month period, then you are also eligible to apply. Another step of eligibility is where you have commenced in a QQI level 5 in healthcare support or health service skills. So you have started this course and you confirm your commitment to completing it within a 12-month period, then you are also eligible to apply. Equally, if you have an equivalent relevant qualification from another jurisdiction, that also confers eligibility onto you. Now, there is a requirement for previous experience of caring in either a formal or an informal setting, so that is something that we also look for. Now, this job, because it's based in the community and the clients live in their own homes, this job will involve travelling. So having a full driver's licence is a requirement, but also having access to one's own suitable personal transport, that is also a requirement in order to be able to fulfil the requirements of the role. Now, in a typical working week, the working arrangements, so currently rostering arrangements are being implemented across Cork and Kerry, and this means that staff work 1 weekend in 4. They work 5 days out of every 7, and they can be asked to work up to 3 evening shifts per week. Now, the local line manager, the home support resource manager, will advise the HCSA on the client caseload on an ongoing basis. And the caseload changes. That would be a normal part of the home support service. And throughout any given week, the healthcare support assistant will have regular contact with the local home support office. And that's important because inevitably in the course of a week there will be updates that need to be communicated. The healthcare support assistant equally in turn will want to communicate observations that they have made relating to an individual client. So that communication is very much central to the smooth functioning of the service. Now, for a healthcare support assistant, there are many benefits to this role. Firstly, there is ongoing paid in-service training. So, as requirements for new training, more updates arise, that is provided as part of the working week. There are a variety of different types of contracts available, part-time and full-time, so that gives great flexibility for individuals who are interested in the role. The basic salary ranges from a starting level at €29,562 per year up to €38,100 per year. And that's basic, not incorporating premium payments which would be paid for Sunday work and bank holiday work. And that translates into an hourly rate starting off at €14.52 up to €18.72. Now, I've mentioned here paid mileage. Now, what does that mean? So essentially, in this role, the healthcare support assistant uses their own private transport, their car, to travel from each client and on to the next throughout the course of the working day. So a monthly mileage payment is paid based on a claim that the individual would make to compensate that individual for the use of their own private transport and for the cost of fuel involved in travelling around in the course of the working day. In addition to that, time to travel is also paid. Now, what that means is in this role, the work happens in the community, unlike in a hospital where it happens in a building. In this role, it all happens in the community. So in the course of the working day, the staff member spends time in the client's home working with the client, but equally they spend time in their car travelling from one client to the next. And the time spent travelling is part of the paid working day, so that's important to bear in mind. This is a pensionable position. There is paid annual leave as well, 23 days annual leave per annum. And for staff who work with us for more than 2 years, we currently have an option where people can apply if they wish to train as a general nurse. They apply through the mainstream CAO as a mature student, but then in tandem they have the option of applying to the HSE for sponsorship to support them during their training. And candidates who are successful in achieving that sponsorship, then during their holiday time from the academic year, they will work with the Home Support Service during their summer holidays, Christmas holidays, etc. And we have many people who have availed of that and have been very happy to do so. So today we are here to promote this role because we have many employment opportunities right across Cork and Kerry, with particular need in Cork City and the surrounding area. Cork City being the main population centre for the Cork and Kerry area. So if you're living someplace in this region, there are many opportunities, as I've said, particularly in Cork City. We have application forms and job specifications which lay out all the finer detail available at the Cork Kerry Community Healthcare Services stand, and our representatives here today will be very happy to speak with you and help you in any way that we can around inquiries in relation to this role. So thank you for listening today, and as I've said, we'll be delighted to help you if you come around to our stand just down there on the right hand side. So thank you for your time today. All right.